Hi everyone, I'm Ally. I'm one of the physiotherapists here at Fit for Life Physiotherapy, and today I'm going to be walking you guys through a set of exercise progressions that can be really helpful in managing low back pain, especially if you have the type of low back pain that's aggravated by sitting, bending over, or even if you're having trouble getting into that fully extended position. So you are going to need either a bed or getting on the floor, whichever one you prefer. And the first step would be to get a stack of pillows. And what you're going to do is you're going to lie just on your stomach, kind of placing your pelvis on these pillows. And you're just going to lie flat and you're going to hold this position here for about a few minutes. And you're letting that discomfort subside in the low back. As it's feeling better, and as the range of motion of the spine is increasing, you're going to be able to remove some pillows and do the same thing, just on less of a height. And you're going to hold here. So as you can see, as I remove the pillows, my spine here is getting a little bit more extended each time. And again, we're going to progress slowly through these and holding for about a few minutes at a time, letting that discomfort subside. Once those are feeling comfortable, we're going to get the spine into even more extension by actually coming onto our elbows like this. Same thing, holding a few minutes at a time, waiting for that discomfort to slowly settle down. And then after this is feeling quite easy, our next step is called sloppy push-ups, and we're going to get into that more repetitive extension instead of holding. So you're going to put your hands roughly in line with your shoulders, and you're going to push up, try to fully extend your elbows like so. And we're going to do these about 10 times in a row. And then our last progression is going to be sloppy push-ups with overpressure. So all you're going to add to this is at the very top of the range of motion here, you're going to exhale. And while you exhale, you're thinking about relaxing your lower belly down into the bed, and you should feel your lower spine really extend even further. I'll do that one more time. Push up, exhale, drop the belly. So same thing with that one, that should be done 10 times. Now, if you're somewhere where you're having low back pain, but you have no bed to go on, or you don't want to drop to the floor, these can be done in standing as well. You're going to put your hands just on the small of your back, and you're going to lean backwards, pushing those hips forward, doing these about 10 times in a row as well. So out of all the progressions I've showed you, you can start anywhere on the line where you feel most comfortable. These types of exercises should be completed 5 to 6 times a day, roughly every 2 hours. It could be a great way to break up periods of sitting and getting our spine out of that flexed posture that we've gotten so used to. If these are significantly increasing the low back pain, or if you're starting to get any pain down the leg, they should definitely be discontinued. If you wanted any further information about these set of exercise progressions, or if you're just looking at some advice on how to manage your low back pain, come see one of our physiotherapists here at Fit for Life Physio, and we can get you set up with an assessment, a treatment plan, and get you back to doing what you love.